It is all connected. And no, I think that's a huge point. And I like your explanation of maybe there's such a heightened state, like calm it down to a four from a mental perspective, but that even extends true to, the peripheral like tissue standpoint as well. Like if something's so agitated, say there's, just crazy irritated nerve for whatever reason, maybe ischemic compression, or maybe it's more from a like metabolic standpoint too. Again, like you never know what factors may be predominant. That's why you continually assessing, continually evaluating the situation and seeing what the patient's responding to. But you may need to apply strategies to calm down the tissue in order to build it back up and get them to a position where they're actually able to raise their threshold in capacity and ability to move forward and make progress. Or say it's chronic pain case, you may need to refer them to go get like a steroid pack or something like that to be able to get to a point. Again, I'm also similar minded to you, and I'm more conservative with my approach to patient care, right? But there's a time and a place for certain interventions to calm
Yeah.
things down in order to build them back up. And so that goes both for the mental health side of things, but also the actual like MSK approach too. But like you said, they go hand in hand. And particularly with the chronic pain cases, like, literature has supported once someone has a tissue insult or an injury, their odds of getting injured again increase substantially. And that's, obviously from a tissue standpoint with recovery and rehab, that once there is disruption to tissue, whatever it may be, specifically, it's not the same after that, but also from kind of a perceived threat standpoint where, inherently your brain doesn't want to put yourself in an environment or situation again where you might receive such an injury, right? So there's two angles there to go at it and see what may be most effective for the person. It's combining those together and being aware. I think the awareness is the big piece with as a practitioner, you're not just, tunnel vision on one certain thing. You need to take a step back and really look at the whole person.